I'm pleased to say we have reviewed and refreshed the 5-year strategy of the charity and finalised it. It will now be available shortly online if you want to see it, and the reviews based on achievements and member feedback through polls, emails, calls, etc. As I say, this will be shortly available on the website for all to see, and we will use the strategy to focus our efforts going forward, providing progress updates via the website, e-bulletins and these webinars. This strategy will drive all our work to ensure you, to quote David there, can live well with CLL. You can enjoy life, make more informed decisions going forward, and have access to the best treatment paths we can lobby collectively for. 3 key themes of the strategy stand out for me, those of informing, supporting, and empowering, and I will use these themes in future updates. The charity booklets have been updated, received a thorough review and refresh with the involvement of CLL clinicians and specialists. You should have received or shortly receive the new booklets. We've had 3 calls saying from members that they've received more than 1 copy out of the 2,400 mailings we've done. This could be because you have registered twice or more than one person in the household has asked for it. What we've advised is, for whatever reason, feel free to pass on the surplus to your clinic when you visit. These booklets will also be made available electronically via the website to make regular updating and access for you and healthcare professionals more manageable. I'm glad the increased regularity of the e-bulletins during the pandemic has been appreciated by many of you based on the calls and emails received. Well done, Brian, who leads the production and publication of these. Because of the challenges of the pandemic, we have an even closer relationship, active role with the executive committee of the CLL Forum. And remember, the CLL Forum are those CLL clinicians, scientists, and researchers across the UK. We work closely with them to plan and schedule webinars into next year, piloting and trials of new tools such as remote monitoring for patients, and providing guidance and advice to hospitals and general hematologists and CLL patients, families and friends on best practice and latest guidance. We are a small focused charity, but we punch above our weight through the CLL Forum Association and alliances such as Cancer 52 and the Blood Cancer Alliance to support your needs and wishes around treatment. These are collaborative groups who pool resources and influencing power for the good of our communities. And recently, the Blood Cancer Alliance responded to a call from the Department of Health and Social Care Select Committee for evidence of impact on cancer care as a result of the pandemic. We helped develop the response and key recommendations to overcome the delays to diagnosis, to treatments and ongoing care of you all. The letter and other work are freely accessible on the Blood Cancer Alliance website. We will monitor the response to our calls and continue to lobby collectively on your behalf. I'm also pleased, having seen Gail, pleased to note the under 60 group Nor and Gail run have 2 small splinter groups. A couch to 5K walk is planned for Saturday the 5th of September. People will complete their walks on their own, but post pictures and videos to the group, and hopefully we'll see them online as well. Secondly, a CLL walking group has formed. The first get-together will be in South Wales on Saturday the 19th of September. So far, 6 women have signed up, so come on boys, where are you? Everyone is welcome. Contact Gail. Their 4 to 5 hours walking is planned for October around Gratham Water, Huntingdonshire. And regarding empowering, we are always seeking more help and support from members to deliver the plans, services and support you want. I'm pleased to announce we've created the role of Associate Trustee, an opportunity for you to offer some time in your skill area to help your charity. And I'm delighted to introduce the first 2 Associate Trustees, Anthea Holland, a retired GP, and Lelia Dooley, a clinician and clinical researcher. They will help strengthen our medical resources. Lelia will initially work on areas such as drug trials, where there are eligibility requirements, and putting the results in plain English that we can understand. Anthony will look at emotional well-being resources and regular reviewing on updating of the booklets to ensure they have the latest guidance. If any of you have some time, say a few hours each month, and have expertise in IT, website management, social media, for example, or finance, accounting, or feel you have a skill that could benefit your fellow members, please email me to set up a chat. Finally, please do consider making a regular or one-off donation via the website, or make use of the free will service information which is in the new booklet pack all members are receiving. I understand there's already been some inquiries and take up of this. While we are all volunteers with only one part-time coordinator to keep costs down, much of this work needs to be funded, and we would like to do more. If you enjoy and benefit from the charity, please do think about making a donation. Thanks very much. I'll now pass you back to Brian.